Hello, my name is Lisa Danley. I'm a nurse practitioner student here at Auburn University, and I'm about to demonstrate doing a physical assessment. Here with me today is my patient, Ashley. All right, before we came into the room, we took her weight, and we took her height. Now I'm about to take her blood pressure. All right. 121/86 with the heart rate of 82. All right. Now I'm going to check her head for, she's got normal hair distribution, thick hair. I'm going to check for any lumps, bumps, or tenderness on her scalp. No. Okay. Now I'm going to check for your sinuses. I'm going to push on your eyebrows, and I want you to tell me if you feel any pain or pressure. All right. This is the frontals.
No pain, no pressure.
Maxillary. None. Okay. Good. Now, while I'm here, I'm going to go ahead and check your eyes, the conjunctiva of your eyes, and your sclera, and your iris.
Okay.
All right. Moist and pink. No redness. Look up. Moist and pink still. No redness. Now, I'm going to check your nares. What I need you to do is take your finger on one side and press, obstruct it, and blow out. All right, good. Do the same thing on the other side. Good. All right. Now, from here, we're going to go, and I'm going to check your ears. All right. Probably going to, first, you're going to feel me, I'm going to palpate the auricle of your ear. Tell me if you feel any pain or tenderness. All right, there's no lesions or anything present. Now I'm going to look in your ear. You're going to feel me pull back on your earlobe.
Okay.
All right. Ear canal is free from obstruction, no redness noted. I can see the eardrum is pearly gray. You can see the incus and the malleus. Good. All right, we're going to do the same thing on the other side. All right, I don't see any lesions on the auricle of your ear. Do you feel any pain or tenderness?
No.
All right, now we're going to look in the eardrum again. Okay, same thing on this side. No redness, no obstruction. Can see your eardrum pearly gray with the incus and the malleus also. All right. Now.
I sure didn't think it was going to be gray. I figured it'd be pink.
Yeah, they're pearly gray.
Yeah, I totally didn't know that.
All right, now I want you to, while I'm here, since I have a light, I'm going to go ahead and have you open your mouth. I'm going to inspect the inside of your mouth. Before I do this, I'm looking at your lips to see if they're moist and pink. Any cuts, scrapes, or breaks in the skin. All right, and open your mouth. I'm looking at the top of the mouth, the sides. All right, lift up your tongue. All right. She has all of her teeth. All right, now I'm going to go ahead and check your gag reflex while we're here. That's cranial nerves 9 and 10. All right. Open your mouth. All right, I'm just going to barely brush this at the back of your tongue. Okay. Okay. All right, now I want you to stick out your tongue and say ah. Ah. All right, one more time. Ah. Okay. The uvula rises and falls symmetrical, so that's good. All right. Now.
Yeah, where I totally thought you were going to go back in there. Like,
So,
what?
no. All right, now because we're going to go ahead and do your nose while we're here too. I'm going to look in your nose. I'm checking to see if your turbinates are intact, any redness, anything like that in there, and your septum also. All right, lean your head back. All right, turbinates are intact, no redness. Same thing, other side. Turbinates intact, no redness, and septum is midline. Good.
What does midline mean?
It's in the middle.
Oh, okay. So that's normal. I don't have a deviated one.
Right.
Good deal.
Okay, let's see. Now, at this point, I'm going to go ahead and do your eye exam to change out the head. I want to get really close to your face for this.
Okay.
All right.
I don't know where I need to look.
You
Just
look straight at the light.
Okay.
And with this, I'm trying to visualize your red reflex, your optic disc, and your macula, and also the blood vessels.
Okay.
Okay, good. I can visualize it all. I'm going to do the same thing on here.
Okay.
I can't.
Sorry.
Because my
Do
No,
I need
you're-
to do it?
No, you're fine.
Okay.
I got it. It's just mixed it. Good. Okay.
Makes my eyes feel funny.
All right. Now we're going to go ahead and test your hearing, which is cranial nerve number 8. All right. I'm going to tap this and put it on the top of your head, and then we're checking for lateralization. I need you to tell me if you hear it on both sides or if it's unilateral. Both sides?
Yeah.
All right. That was the Weber test. Now we're going to do the Rhine test, and it's testing air conduction and bone conduction. And normal air conduction is 2 times longer than bone conduction. Tell me when you no longer hear the sound.
Okay. Okay.
All right. And I'll do the same thing on the other ear.
Okay. Oh, Jesus.
All right, and before we came into the room, we checked her vision, which is cranial nerve 2, with the Snellen eye chart, and it was 20/20, uncorrected. She doesn't wear glasses. Then we're also going to do check her visual fields for her peripheral vision, and with that, all right, I'm gonna all right. I'm gonna bring this object in from the side, and I want you to tell me when you can see it. Stay looking at me, but tell me when you can see it.
Okay.
All right, good. I'm gonna go ahead and check your reflexes on your pupils.
Okay.
Just looking to the light.
Oh.
Okay, good. Pupils are equal, round, and reactive to light. All right, and then we're going to check for accommodation while we're here, which is also cranial nerve 2. All right. I want you to look at the pen. Look back and forth from the pen to the wall. From the pen to the wall. Good. Now pupils are accommodating. All right. from here, we're going to do we're going to test for confrontation. And with that, I don't need this right now. With confrontation, I'm going to stand about 2 feet away from you. And what I'm going to do, I'm going to wiggle my fingers, and I'm going to do it from different angles. And when you see my fingers come into your peripheral vision, you're going to say yes. But stay looking at me.
Okay.
Right.
Yes. 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 Yes.
Okay, good. All right. Next, we're going to check for convergence. All right, with convergence, you're going to, this is going to be weird. All right, you're going to watch this, and I'm going to bring it in to your nose.
Okay.
You're going to watch it. Good. All right. All right, now we're gonna do your extraocular eye movements, which is cranial nerves 2, 3, 4, and 6. And that you're gonna follow the pen. I'm gonna do a series of movements in an H pattern, and I'll pause. Follow with your eyes and not with your head. And we're looking for nystagmus. You don't want any nystagmus.
Okay.
It's weird.
It was weird. I was having to remind myself, like, whenever you pulled it up, not to look up.
Yeah. All right. Now, at this point, we're also going to check, I need to check her cranial nerve 1. That's your sense of smell. And the way that I'm about to do this, I'm going to have you close your eyes. I have 2 different scents, and I'm going to check each side with a different scent. But I'm going to bring it under, and you're going to tell me what you smell.
Okay. I didn't know if you were smelling. I'm not ready. Okay. Smells clean. Oh yeah, enlightenment.
All right, and then I'm going to do the other side with a different scent.
It sounds sweet.
All right, cranial nerve 1 is intact. Now, we also can do, there's another one for hearing, your cranial nerve 8. It's the whisper test. It's testing your auditory acuity. And what I'm going to do, I'm going to whisper something in each of your ears, and I want you to repeat what I whispered in your ear back. All right.
Can I say it now? Worryful. I bleed orange and blue?
Yes.
Okay.
Good. All right. Cranial nerve 8 is intact. Now we're going on until cranial nerve 7, which is your facial, and I'm looking for symmetry and drooping. Okay. All right. I got a series of movements for you to do, and I'm going to tell you what to do, and you follow the commands.
Okay.
All right. Raise your eyebrows. Smile, frown, clench your teeth, and puff out your cheeks. Good. Cranial nerve 7 is intact. Now on cranial nerve 5, we're going to check for sensations on her face, and we're also going to check, we would check her corneal reflex with a wisp of cotton in the eye to see for inducing a reflex, like a blink reflex in your face. And we would also check your temporal mandibular joint.
Okay.
Temporal masseter joint. Sorry. All right. Now here, open your mouth and clench your teeth. Okay. No tenderness. All right. And there's no clicking or popping. All right. And then this is when we're also going to test your sensation. I need you to close your eyes. And you're going to tell me when you feel dull or sharp.
Sharp. Dull. Sharp. Dull.
Good. All right. Now we're going to go on into cranial nerve 11, which this with this one, when I'm going to push down on your shoulders, and I want you to shrug up to my resistance.
Okay.
All right, shrug up. All right, good. And we checked her cranial nerve 12 with just with the conversation, and it's intact. There's no slurring of speech or anything of that sort. Now we're going to go on to do your neck. All right. First of all, it's free of lesions, skin's appropriate color. Then we'll check her trachea. All right, it's midline. Now I'm gonna I'm gonna palpate your lymph nodes here. All right. It's occipital, postauricular, preauricular, parotid, retropharyngeal or tonsillar, submandibular, and submental. Okay. Posterior cervical, there's 2 chains. Anterior cervical. All right, good. Now, also supraclavicular. Now, what I need to do is, can you turn to the foot of the bed? I've got to check your thyroid.
You want me to lay
No,
head first?
Sit up. Put your feet to this side for now. I got to be able to get behind you to check your thyroid gland. And this you'll also need to swallow for. All right. Now, you're going to feel my hands on your throat. And when I tell you to swallow, swallow. All right, swallow. Good. Thyroid's normal. No mass is noted. All right, now you can come back. All right. Now, at this point, we're going to move on to, I see no JVD in her external jugulars. I'm going to check your carotid pulses, and I'm going to also listen.
Okay.
All right. Both carotid pulses are present in 2+. All right, now I'm going to listen with the bell of my stethoscope. All right. All right, here, I want you to take a deep breath in and hold it, and I'll tell you when to let it out. All right, deep breath in and hold it and let it out. Good. Deep breath in, hold it, and let it out. Good. All right. All right, now here I'm going to actually look at your posterior chest, which is the back. I actually do need you to turn back this way so I can get to your back.
Okay.
All right. You would actually want the patient to have their shirt off at this point and gowned, but for demonstration purposes, the shirt is on. The skin would be normal color, free of lesions. Now, at this point, I would tell me if you feel any pain or tenderness.
No.
All right. No lumps or bumps present. Now I'm going to check for your diaphragmatic expansion. All right. I want you to take a deep breath in and out. Good. Your diaphragmatic expansion was symmetrical. All right. Now, at this point, I'm going to put my hands on your back, and when I tell you to say 99, when I say 99, repeat 99.
Okay.
All right. 99.
99.
99.
99.
99.
99.
Good. All right. Now I'm going to percuss for her lung fields on the back of her posterior chest. You should hear hyperresonance. Good. Good. All right. Now, at this point, I'm going to go ahead and listen to her lung sounds with the diaphragm of my stethoscope. All right. When I tell you to take a deep breath in and out, do so.
Okay.
All right. Deep breath in and out. Good. Deep breath in and out. 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 All right, deep breath in and out. Good. All right, I'm also going to check for CVA tenderness here. I'm going to percuss for it. So here at the costovertebral angle, I'm going to percuss and tell me if you feel any tenderness.
No.
Okay, good. All right, turn back around facing me. All right. Now, I'm going to do the same thing on the front side of your chest.
Okay.
All right, chest is symmetrical, respiration's normal. Then no lesions, masses, lumps, or bumps. Now at this time, I'm going to do the same thing. When I put my hands on your chest, I'm going to say 99.
Okay.
All right, 99,
99.
99,
99.
and 99.
99.
Good. All right. All right. Now I'm going to listen to your lung sounds. And you'll do the same thing. Take a deep breath in and out.
Okay.
Okay. Deep breath in and out. 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 All right. Deep breath in and out. And one more time. Deep breath in and out. Good. All right. Now at this point, I'm going to listen to your precordial heart sounds. First, I'm going to listen to them through with the bell of my stethoscope.
Okay.
All right. Aortic, pulmonic, tricuspid, and mitral. Good. I'm going to do the same thing with the bell. Aortic, pulmonic, tricuspid, and mitral. Okay. All right, now I need you to lay down, and I'm going to repeat the same thing.
Okay. Yeah, I hate this paper so much.
All right, at this point, I would actually check for her internal JVD distension if she had any. With a light. I didn't, and a tape measure. I didn't have a tape measure, but we'll say that it's normal, no JVD. All right, now, same. All right, with the diaphragm first. Okay, put your hands at your side.
Okay.
All right. All right. Aortic, pulmonic, tricuspid, and mitral. Okay. Aortic, pulmonic, tricuspid, and mitral. Okay. All right, let's stay laying down. I'm just going to set this to the side. All right, now still hands at your
Sorry.
side. It's okay.
It's
All
having.
right. All right. Now I'm gonna actually palpate for any thrills.
Okay.
Okay. And actually, I need to check your renal arteries and for your abdominal aorta. I'm gonna check for bruits.
Okay.
And I do that with the bell of the stethoscope. All right. Aortic. There's nothing. That would be the left renal artery. right renal artery.
So I need to move my pants.
No, it's good.
Okay.
Left iliac and right iliac. Now, you would also check for bruise of your femoral arteries also. Now, I would, at this point, I'm going to percuss for your liver span.
Okay.
All right. All right. And I'm gonna come up and I'm gonna do the same from the top, palpating down mid-clavicular. Good.
It's supposed to sound like
Yeah,
that?
it's supposed to sound dull.
Okay.
So your liver span is about 6 centimeters if I had a tape measure.
Okay.
All right. Now I need to listen to your bowel sounds, and then I'll palpate for masses. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant.
What does it sound like? Did it sound like gurgles?
Little gurgles.
Little gurgles?
Timpani. Their bowel sounds are 2+ and normal.
Okay.
All right. Now at this, you're gonna feel me push on your tummy. First, we would do a light palpation. You tell me if you feel any tenderness,
Okay.
and then I'm gonna do deeper palpation to feel your liver, see if I can feel your spleen, and I'm also gonna do the same thing for your kidneys.
Okay.
All right.
Nothing, no tenderness or anything.
Okay.
I can just feel you. That's really it.
That's it. Okay. Now I'm gonna push on you deeper.
Okay.
All right.
Do I need to move?
No, you're good.
Okay.
It's gonna just find under your rib cage.
Yeah.
Right there.
Yeah, right there.
No enlargement. Okay, good.
Okay.
All right. And there shouldn't be any over here.
Yeah, I don't.
Now I'm going to palpate your kidneys.
Okay.
To see
Do
if I
you
can
need to
feel.
turn over?
No, you're good.
Okay.
You lay flat.
Okay.
All right. You're good. I'm going to do the same thing, but it's lower.
Mm-hmm.
Good. Okay. Now I actually should have done this before I did the palpation, but I would percuss also on your abdominal button for sounds.
Okay.
You should hear timpani because if they have air. Good.
I heard it best right here.
Since I've already got you laying down, I'm gonna go ahead and check your pulses on your arms. And
Okay.
All right. Brachial. Radial. Good. And you're 2+. All right, now you can set up. All right, now we're going to check your shoulders. And all right, I'm going to feel on your shoulders. Tell me if you feel any pain or tenderness in your shoulders. No? Okay. Now I'm going to go ahead and I'm going to check your reflexes. We'll do this arm first.
Okay.
All right, first one I'm going to check is your bicep.
Okay.
Relax it on your leg. Okay, good. And I'm going to strike it. Okay. Then we're going to do your tricep, arm up, kind of hanging, just relax. We'll find the tendon right there. Okay. Okay. Now, relax it out on your leg again. And this is the brachioradial. Okay.
Yeah, that one.
All right. Same thing, other side. Just relax it. All right. The bicep. Okay. Bring your arm up. Okay. And your tricep.
Jesus.
Alright, sorry. Alright, now the brachioradial on the right side. Okay, good. Now I'm going to test you for pain sensations on your arms. Close your eyes. Tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull.
Yes, good. Okay. All right. Now, right now, we'll go ahead and test your hand strength. I want you to squeeze my hands. Squeeze them as hard as you can. It's testing the strength in your arms and hands. Just squeeze.
I don't want to hurt.
It's okay. Squeeze. Okay, good.
Okay.
All right. Now we're going to check your range of motion in your shoulders. All right. I'm going to show you a series of movements and then you follow them. Flex up. Extend back. All right, good. Now, adduction, abduction, external rotation, internal rotation. Good. All right. Now, at this point, we're going to move down to your elbows. All right. I'm going to palpate for any tenderness and check for any epitrochlear nodes. No tenderness? All right. Okay, good. Now, we're going to check the range of motion in your elbows.
Okay.
So I need you to flex up, extend out, supination, pronation. Good. All right, we're going to move down to your wrist.
Okay.
Same thing. Any pain or tenderness? There's no swelling. Okay, good. Now we're going to do the same thing with the range of motion. Flex down, flex back, side to side. And also flex your fingers for range of motion. Okay, good deal. Now, because we're here, I'm going to go ahead and check your capillary refill in each of your fingers, on each of your hands. Good. All right. Capillary refill is normal, less than 3 seconds. All right. Now, I need you to lay back down. We're going to do the same thing on your legs. Check your range of motion and your sensations on your legs.
Said something about feet, so go ahead and get ready.
All right. Good. All right. Now, here, I want you to, you're going to, for the legs and the hips, you're going to flex up, bending your knee. Flex up, bending your knee. Good. Extend out. All right. Down. Same thing on this side. Flex up, extend out. Good. Down. All right. And I need you to take this leg and go across your body. That's abduction. Okay, good. And now take that leg and extend out. Go out. That's abduction. Good.
Okay.
All right. Do the same thing with this leg. All right. Across your body.
Right.
Abduction.
I can't go all the way out.
But you would go all the way out if you could for abduction. All right. Now we'll go down to your feet, to your ankles. Well, first we do your knees. No tenderness, no swelling. All right. Then on your ankles, I need you to flex back, point out, toes in, toes out. Good. Now, there was actually, let's see, capillary refill. Sorry. All right, go check the capillary refill on your toes.
Okay. Oh, sorry.
It's all right.
I'm sorry about my feet.
Good. Good.
Sorry, I feel like my feet are so cold. Your hands are so warm.
All right. I'm going to go ahead here. I'm going to check your pulses.
Okay.
This is your popliteal. Good. Good. All right. Then we're going to go down in the dorsalis pedis.
Wait, you can check for a pulse there?
Yeah.
I didn't know that.
And then your posterior tibial.
That's pretty cool.
Good. They're 2+ and normal.
Okay.
All right. You can go ahead and sit up for me. All right. Stay sitting. Stay sitting. I gotta check your reflexes on your feet. I gotta check your patellar And your other, I should have checked these when I did the ones on your hand, but.
Okay.
All right, there's the tendon. It did elicit a little response. There's the tendon. Okay. That's your patellar.
That one
reflex.
was real intense.
All right, and then we're going to check next your Achilles reflex.
Okay. Jesus, Lisa.
All right, one more time. Okay, good deal. Now, one more. You're probably going to feel a tickling sensation. This is the Babinski reflex on the bottom of your foot. I'm going to brush the bottom of your foot with this.
Okay.
Toes should come.
Yeah, I felt my toes instantly like, ooh.
Now, I forgot to do this, so I'm going to come back to this. We're still on the legs, so I'm good. I'm testing the sensations on your legs for sharp or dull.
Okay.
All right, close your eyes.
Sharp. Dull. Sharp. Dull.
Okay. Now, all right. I need to check this too. The stereogenesis. I'm going to put an object in your hand. Your eyes are going to be closed, and you got to identify what that object is.
Okay.
All right. First, your right hand. Close your hand.
Do I have to tell you what it is?
Yes.
Oh, it's a coin.
Okay.
I can't tell you exactly. It feels like a quarter.
Yes. All right. Go to the other hand.
Okay.
Different object. All right. All right.
Paperclip.
Yes. You're good. All right. Now, at this point, I'm going to check your spine, so stand up for me.
Get the shoes off first. Okay. All right.
All right. I'm going to check for alignment of your spine. You're going to feel me feel down your spine. And, of course, your shirt should be off for this. All right. Alignment is good. Now, I need you to flex forward. Okay. Up. Hyperextend back. All right. Good. Okay. Go side to side. All right. And twist. All right. Good. Now I'm gonna check for your gait. What I need you to do is step to this wall over here. Over here. All right. And I need you to walk towards me, like heel to toe. All right, good. And then do the same thing. Turn around and do the same thing back, the other direction. All right, good.
That's such a small spot.
All right, that's good. All right, thank you.